My name is Nana Eyeson-Akiwowo, and I'm the founder and executive director of African Health Now. In 2006, I started African Health Now after my father suffered a heart attack. I was at work here in the US and he was back home in Ghana. And that moment, that call, changed my life forever. And so I started this initiative to help the community that helped him recover. The reality for most Ghanaians and for most people living on the continent is that for most clinics, it's one doctor for every 200 patients. And just imagine your child has a common cold or malaria or something of that sort, and you have to go to the hospital. Or if you have a heart attack and you get sent to a clinic and you're now standing online waiting. So I wanted to do something just for the community initially and just for this neighborhood that we lived in and called Pokwase. And so I just called some friends and was like, hey, I thought about doing this health fair. We're gonna be in Ghana. You just volunteer the time, I'll get all the supplies. I called everyone and was like, I need toothpaste, blood pressure machines, gloves. And I got the doctors, I got lawyers, I got translators, and they volunteered and we set up shop. And that day, 350 people showed up, more than that lived in that little neighborhood. And we kind of realized from there that there was definitely a need, and what we were offering was just primary care. So what we do with African Health Now, even for that one day, is give them an opportunity to come and speak to a doctor and find out what's really wrong with me. Even if it is a blood pressure screening, even if it is seeing a dermatologist for the first time, you have an opportunity to ask a doctor a question that doesn't require you to stand outside and wait forever or have to spend your last 10 Ghana cedis or your last money on. So for us, we bring that resource. We bring the doctor to you. It's a free of charge. You come, we show up, and we set up tent in your community. We're not setting up tent somewhere where you have to travel. We set up tent in your community. And that's something that, we try to drive home, the understanding the accessibility to a doctor, just to ask him, what's wrong with me? Can you look at this? Is so important to people who just don't go. This is my mom, Elizabeth Nkansa Eyeson.
Oh, I'm very proud of her.
She stuffed a lot of gift bags when we have to translate to the women, especially about breast cancer and getting them to understand. It's great to have my mom there because she can just go right in and talk to them and they seem to relate. So I always try to have both my parents at every health fair. Each fair costs upwards of $5,000 to $10,000, and we've been able to match it and scale it down and cut costs and make do where we can. But the reality is that we just really can't continue that way, and we have long-term goals that we need help to fulfill. Being able to sustain the project that started off as a dream, understanding that, it was really just, it was a dream. It was just kind of like, oh, I just want to do this for my dad. And then now it being this organization. I will admit that I'm also proud that when I go back home, and I appreciate every time an old lady who could be my grandmother comes to me and says, it's the first time I've had my blood pressure checked, thank you. And that for me means that I'm really doing something. I really take pride in that because I want them to know, and I want my father and my parents to know that they raised me to be someone that understands the importance of giving back. I think the proverb says, to whom much is given, much is expected. I know that for me, those are my proud moments. Being able to just go home and make a change, and make a change. That's important to me.